everybody. We want to welcome you here to PrimePay's exclusive Broker Concierge Partner CE webinar. We're thrilled to have you here today. The title of today's webinar is Health and Welfare Benefit Notice Requirement Checklist. Did we throw in enough words there for you? So we've got a lot here to talk about, and my name is Steve Jackson. I'm the Senior Vice President of Strategic Development and Channel Sales, and we want to welcome you. I want to welcome you here to our webinar today. This is an important day for us. We don't have too many opportunities for us to even begin to thank our broker concierge partners. And an event like this was structured so that it would be exclusive, generally exclusive to our broker concierge partners across the nation. We are thrilled to be able to partner with so many of you, we just thank you for the support that you provide, not only in referring certainly PrimePay solutions to your clients, but I also am grateful for the confidence that you have given us in providing technical guidance, sales strategies, support in your efforts to greater differentiate your service, your solutions, ultimately to your clients. So we could not do it without you, and that's why today we wanted to provide at least a webinar that could provide an hour of continuing education credit. I know that we're not able to provide it to every state across the country, but in the event that you're not able to get credit, we still will dedicate this webinar to provide the best content available here for you today. So since this is a continuing education approved course, I do want to cover some specific logistics here with you, if I may. So these are a little different in relation to our normal webinar. The standard questions that I receive, will this presentation be recorded? Will I receive the slide deck, the presentation slides for my review? The answer is yes. We want to accommodate everyone so that you can take this afterwards and go through it at your leisure and develop, the content and information that you need to support your clients directly. But in specific to the continuing education, we do have some specific requirements for today's webcast, and I need you guys to all look at this very good. So there is a 1-hour CE credit approved in the following states: so Connecticut, Virginia, Pennsylvania, New Jersey, New York, Delaware, Ohio, Oregon, California, and Maryland. Okay, in those states only. All right. You must be registered as an individual to receive the credit. So many of you will be viewing this as a group, and if CE credit is not needed per se, that is fine. We welcome that. We'd love for you to do that. But if you need CE credit, you must be registered as an individual, or the only one registered that's reflecting, if you're in a group, the only person will be the one that was registered that will receive credit. You may experience difficulties of viewing on a tablet or mobile device, and it's not difficulties in really the viewing, I guess I should say. It's really just in your ability to participate in the webinar. So if you think about regular continuing education courses, you have sign-in sheets, sign-out sheets, you have an attendance that you need to partake in, right, in order to achieve that. And so what we're able to do through webinars is engage you through some active participation. So there's going to be 4 opportunities, one at the very beginning, 2 in the middle, and 1 at the very, very end. And your participation is important. You need to be participating at 100%. And so when I show you the first participation, kind of action item, it's easy. You just need to go onto your computer and select the answers of the questions that I provide. And the part is, you don't have to get the questions answered correctly. We just need you to participate. Okay, so just do your part in participating. That way we can adequately show that you attended the entire webcast here today. For those of you who didn't just register last minute, you may not have received an attendance sheet. I think I got a question on that already. So prior, maybe, I don't know, this morning or, here East Coast time, we did send out attendance sheets for those that we saw were registered, okay? And if you do not have, or if you've not received it, you can reply to concierge@primepay.com or simply wait. We'll get it to you. We know who you are, and we'll get those attendance sheets to you. But what we would ask is that you complete those attendance sheets, as far as sign in, sign out, and return that no later than the end of day Friday, May 20. Oh, well, I have Friday, May 26th. Yeah, so end of day Friday, May 26th. So if you would, and actually, as I'm thinking of that, I believe what I wanted to do was the 22nd. So tomorrow, May 22nd is what we are looking for here. As far as getting that information, I'm sorry about that. It's not Friday, May 26th. It is tomorrow, the 22nd. So I'll reference that here at the end. Lastly, then, is we just want you to take notes, enjoy. We've got a lot of great content here for you today, and we want you to just kind of enjoy it. You can feel free to ask questions in the question box. I'll do my best to answer those questions throughout. We'll take a look at that at the end of the webinar, and if we need to put together a frequently asked questions based on the webinar, we'll do so, and get those out to you when we do our follow-up email, okay? So let's enjoy. Let's kind of get into this here, but first, before we do, I told you that we are going to do some participation, so I want you guys to get ready. I'm going to enact here the first question to ask, and all you need to do is simply answer the question, okay, and click on the answer of your choice, okay? So today is May 21st, 2015. Which of these events happened on this very day in history? Was the American Red Cross founded here today? Did Connecticut pass the first speed limit law here on this day? Ever, actually, I guess. Chuck Berry recorded Maybelline. Soap star Susan Lucci wins her first Emmy, or all of the above. You can only select one here. And so if you would, go ahead and click on that. We're going to give just about a minute here for folks to do that. So go ahead and check that. Very important that you participate here right out of the gate. All right. You guys are doing great. All right. Just give you here another 10 seconds, and I'll close the polls. Good work. All right, awesome. Okay, I'm going to close it. So let me share that here with you. So 65% of you chose all of the above. So for those of you who did select all of the above, you are correct. But if any of you had selected any of the other four, you are also correct, because on this day in history, the American Red Cross was founded back in 1881. Connecticut was the first state to pass the first speed limit law in 1901. Chuck Berry did indeed record Maybelline on this date in 1955, and after 19 nominations, Susan Lucci won her first Emmy back in 1999. So there you go. All right. So let me hide that here now, and let's move on. So, as we were putting together the CE here for you today, and thinking about, we've got an hour's time, we want to reflect, there's a lot of notices and disclosures that you as as an employer that you're required to provide, to your employees. And there's a lot of jurisdictions, right, from IRS and the Department of Labor and the CMS and HIPAA and just so many that you can touch on. And so what we wanted to do, though, was really try to focus on some of the key annual notices and disclosures that are really the must-haves. These are not ifs and, should I kind of have this information available to my employees? The answer is you need to have these. And so we've kind of created a checklist here for you that begins with these. And I say begins because as you know, with the Affordable Care Act and HIPAA and ACA. I mean, all these different things. There's been a lot of changes and additions all along the way to some degree. So this won't be the end, but we're going to cover these 5 key areas. And I think once you start to see the content laid out, I think you'll see that we've kind of delivered this in a real easy way for you to not only understand what the notices are about or the disclosures are about, but you're also going to be able to communicate this to an employer. One other thing that I want to kind of mention here with this is that, you also need to think about where do these notices, where do these disclosures, where can they be found? Am I getting them from a carrier? Is it a benefits attorney? Is it a third-party administrator? Is it just the employer? Is it you? Where do these come from? And we'll try to touch on that here as I go along here today. So the first one that I really want to touch on here with you today is ERISA. And you're going to find that the Affordable Care Act has significantly placed ERISA out in the forefront when it relates to health and welfare benefit plans. Clearly, ERISA has been around, for 40-some years, and it is as real today as it was back then. But the enforcement of ERISA on pension benefits has been hugely utilized. A lot of scrutiny in the pension benefit market, but a lot less on the health and welfare benefit side, although the requirement has been there from the beginning. So the demand here, due to ACA, the demand for ERISA disclosures, notices and disclosures is extremely important. And but before I kind of touch on a little bit of its importance, to kind of lay some weight. Some of you who might have been on some other webinars that I have done kind of more specific to ERISA, I think I have shown this here before, but the main point I want to make before we get into this is that there is real enforcement that is now going on as it relates to ERISA and health and welfare benefits. And you'll see here that there are 3 cases and penalties given here for basically the same thing. It's where an employer has failed to provide a summary plan description either on a timely basis or even just given to the employee at all. So they failed to provide that notice, and you see the penalties there that apply. And what these end up coming down to is the statute that basically just says, look, I mean, any administrator and employer, who fails or refuses to comply with a request within 30 days after such request, if they fail to furnish that participant within 30 days, the court's discretion can say, listen, you're going to be personally liable in the amount of up to $100 a day from the date of such failure or refusal. So, this is, in my mind, this is an easy thing. As benefit brokers, it's your opportunity to be able to reduce compliance risk for your employers. And so if we were to look at this large target, and why I'm starting with ERISA is that this is a very big target with which things are being enforced with right now, and it's an easy way for you to engage your employers early on to ensure that they are complying with some simple things, okay? And so that's really what I wanted to touch on here from a penalty aspect to get your minds thinking as I go through the list here today. So I have, it's kind of small there, and you see there the cards. The cards just crumbled down. When you think about the foundation, when you think about maybe some of the foundations of compliance, ERISA is in my mind very much the foundation. There's many things, and I'll keep repeating this here throughout. ERISA enables an employer to comply with many of these notices and disclosures, to be honest. So an employer having ERISA documentation, they're going to be able to fulfill many of the general requirements, okay? So this foundation is critical. We all have done the 52 deck of cards and built something, right? I remember doing that as a kid. And one card that comes out can allow that entire house or whatever you were building with that stack of cards, you can have them crumble down. And so this ERISA, let's look at this because often it builds the foundation for how your employer is going to comply and it actually will help tremendously with their compliance. So one of the first things clearly that is out there is the plan document, and plan document can look a couple different ways. It's basically stating to the IRS in an audit, it's basically saying, look, employer, or the employer saying, look, I have an ERISA plan, plan or plans, and the plan document basically says, you've kind of brought it to life, okay? No different than a Section 125 plan, cafeteria plan. The documents are so vitally important to truly state that you have a cafeteria plan. So in this case, plan documents for ERISA are very important, and these can be standalone plan documents or clearly could be, as I list there, a wrap or umbrella plan document that actually encompasses many, several, or all of the ERISA qualified plans into one document. Regardless, it doesn't matter. It could be a wrap document or it could be standalone, okay? But the plan document is vastly important. So to whom, and we're going to do this for every single notice. So we're going to go through the type, to whom, and when. When are they supposed to be delivered on every single one? And I think it'll be very helpful for you to have that information. So clearly, plan documents need to be made available to participants and beneficiaries, and they should be distributed no later than 30 days after a written request, okay? A lot of, we'll touch on the summary plan descriptions here in a second, but the plan document is again, a vital document that would be made available to participants and beneficiaries. As we go further with the ERISA checklist, we also now get into the summary plan description. As I had shown you that slide reflecting penalties, you'll notice, and if you were to do a search on the web in regard to court cases around ERISA and health and welfare benefits, you're going to find many cases where the document, the summary plan description, which is really truly the employee piece, providing the employee with all the detailed information about the ERISA plans. When they do not have that availability, that's what's creating a lot of the enforcement activity. On a previous webinar that I had gone over, I had stated that the EBSA, which is the main enforcement agency under the Department of Labor in this area, they had received over 200,000 formal inquiries from participants and beneficiaries about employers not fulfilling this particular requirement. So as part of the, kind of the health and welfare checklist here today, the SPD, if I could put a bullseye on anything, it would be on this summary plan description. It's the primary document for participants. It would need to go to participants and beneficiaries, and it's needed to be given to them within 90 days of being covered by the plan. If there were any, let's say this, if there were no specific updates to those plans, okay, within those plan documents, then you would not have to distribute another one for 5 years. If there were updates, you do it every 5 years. Otherwise, you would do it every 10 years if there happen to be no changes. Now, generally, from year to year, there will be updates, and I'll talk about a summary of material modification here in just a second. But generally speaking, you're looking at providing this on a, within 90 days of being covered by the plan. There are a couple ways certainly to be able to provide or distribute these documents. You can do it electronically, but you will need to adhere to the, I'll call, more stringent Department of Labor safe harbor rules in electronic distribution of these documents. And certainly the other way to deliver that is by paper, in person, and then receiving a written signature consent, that it has been received. The second item, and still vastly important, and something that you're actually going to see, really, you'll see it yearly. There's always going to be changes, right, that changes to the plan that affect the SPD. There could be eligibility requirement changes. There could be appeals notice language changes. I mean, there's a variety of different things. You went from one dental carrier to another with different information. An SMM, a summary of material modification, will be required. And it just basically describes what changes are to be made. So you don't necessarily have to go in and change the summary plan description every moment with every change. You simply need to create a summary of material modification and provide that. So when? Automatically, in essence, basically as soon as possible, you would give it, but no later than 210 days after the end of the plan year. So there seems to be this, now or later, crazy how the Department of Labor states it, but there is some freedom in regard to, when that SMM would be delivered, but no later than 210 days after the end of the plan year. The next item is the notice of benefit determination. This is going to be involved in the use of claims when a claimant has specific issues in regards to claims, denials of claims, or they're making an appeal of a specific claim. And so this would be information, this notice would provide information regarding the kind of the benefit and adverse benefit determinations of those specific claims. And I just show some examples there because some of you, may go, well, I don't know if I'm totally following you. It's just specific reasons for denials of claims, plan provision references, appeal procedures. It's kind of providing information. A lot of carriers will provide some detail in regard to, how the appeals process might be. Well, this is also found directly in your ERISA documentation there as well. So it will go to claimants, so participants, beneficiaries, or claims representatives, and then it will vary as to when that needs to be delivered based on the type of plan and the claim involved, okay? I mean, carriers are going to have specific rules or requirements around that, but it will vary. So I can't necessarily provide an exact timing for you in regard to that. So the next item here is the summary of material reduction in covered services or benefits. Now, to some degree, there are, as you look at where consumer-directed health care, high-deductible health plans have kind of gone, right? Employers have put more of the out-of-pocket exposure, financial exposure on the employees. Deductibles have been increasing. Co-insurance has been reduced over the years. And so under ERISA, as part of a notice, is the summary of material reduction in covered services or benefits. And it's basically that summary of what had materially changed, okay? And this information is added to the SPD, so it's very important in regard to the SPD how this information is listed, okay? This is provided to participants, and within 60 days of the adoption of material reduction in group health plan services or benefits. So you see there, it doesn't say prior to, it's just within 60 days of adoption of that. So this is a specific notice as it relates to a reduction, a material reduction in covered services or benefits. The next item is a summary annual report. Now, for your employer clients who are required to file a 5500 form, a specific notice each year then, based on that filing, is called the summary annual report or SAR report. Now, many times you see this in a 401k or pension benefit setting, but this would also be required for employers who are 5500 filing for their health and welfare benefits. So the summary of the 5500 filing, I mean, it's simply a summary, okay? It's taking all the details of the different schedules and information of the plans, putting it into a summary, okay? So it's basically a summary of the filing. But it would be given to all participants, and it would be automatically given either within 9 months after the end of the plan year or 2 months after the due date of filing, and I'll touch on that here a second. So there are some specifics here. I mean, if you read that, it's roughly 60 days after the filing occurs, or possibility of an extension that could be granted for that employer to provide a SAR report to each of the participants. So a SAR report is for those employers who need to file a 5500. So small plans with fewer than 100 covered participants at the beginning of the plan year would be exempted. but all other employers, so a SAR report would only be needed if a specific ERISA qualified plan, or in a wrap document, the total number of participants, if there's 100 or more employees, participants, at the beginning or the start, the first day of the plan year, then you would be, as an employer, required to file Form 5500. And so there's various schedules concerning the plan, and based on the ERISA plans that you need to file for, you will complete different schedules, and there's just little different pieces and parts of information that's needed for each of those schedules, but general basic information that's there. And then that would be provided annually to the Department of Labor, okay? And it's due by the last day of the 7th month after the end of the plan year. So if you had a 12/31 end of a plan year, you're looking at July, the end of July of that next year is when you would need to file, or if a 2.5-month extension, was offered. So I'm going to try to do this for each section header here, but try to give you a best practice here, if I may, in regard for employers as you're talking with employers, kind of, some key things that I would kind of look out for. I mean, I've already stated that the summary plan description is key. You got to have it. An employer must have it. Enforcement is real. But I'd also say a best practice with what I have seen in the different suits and court cases that are out there today and the decisions that have been made. If an employer can provide these documents, most of these notices, the summary plan description in paper format, delivering it by mail or by certainly in person, and then getting a written consent that they've received it, that would be the best practice. There are electronic means and opportunities for an employer to adapt an electronic disclosure and consent, but best practice would be to get that in paper form. So that now moves to our next poll question here for the day. So let me line that up here for you. Here we go. I'm going to launch it. So I need everybody to get to their computer. So this is the second one here today. So as you see here, the summary plan description needs to be provided to participants and beneficiaries by what date? So there are 4 options listed there. Might take a little bit of time. Okay, just read through there. 60 days of being covered by the plan, 30 days upon request from a participant asking for a said summary plan description, 210 days of being covered by the plan, and then 60 days, 90 days of being covered by the plan, 30 days upon request, 14 days of being covered by the plan, 90 days upon request, or none of the above. So I'll give you here a few seconds here, certainly a minute here, clearly, to get through that. You guys are doing great. Again, it's not about being right. It's just about participating. So if you're stressing through it, just click one, and that's quite all right. All right. All right. Let me get. I'm going to close it here in just a few seconds. Give another 10 seconds. Good work, everybody. Oh, you guys are doing good. Okay. I am going to close this up. Good work. So let me close that. Let me share this here with you. So as you can see, we had 69% of you stated C, 90 days of being covered by the plan, 30 days upon request. You guys are correct. So well done. So many of you had put selected A, but that is wrong. And but hey, that's okay. Thank you for participating on that. So 90 days, really some key dates. A lot of the cases, and why I wanted to reiterate that was that last part, 30 days upon request. If you ask your current client or a prospect today if they could deliver a summary plan description to their employees within 30 days, and and the look on their face says, what is a summary plan description? You have an opportunity to have a discussion, certainly with them. All right. So let's keep moving along here. The next item is COBRA Notices. Now, many of you, there's not a lot here that I can say that's new. There are a few things, possibly. But, the main answer to this question: have COBRA requirements been reduced? I mean, absolutely not. Have some things maybe gone away because, or the use of actually COBRA beneficiaries enrolling in benefits due to their life event, as that kind of occurring? Yeah, that's the truth. But the COBRA requirements have not gone away at all. And I want to just reflect this here, if I may, then, before I get into this checklist. The Department of Labor has been enforcing COBRA through EBSA for the last several decades, right? In March of 2012, the IRS came out, and I'll be giving everyone this slide deck, so you'll be able to click right onto that link that I have there. But that link from the IRS goes right to their page that details the examination procedures, so that when they go into an employer, specifically about COBRA, they basically state, here's what we're going to look for. This is what the employer is going to need to deliver to us. And on the right-hand side there, I showed kind of our just quick version of a checklist, but there were 15 items that is listed, and I would highly recommend that you go there to see, and we can easily provide this checklist for you so that you could sit down with your clients and just simply go through a yes or no. Can you, if you had an auditor walk in today, could you provide or give these details to that auditor? And this will be a great checklist that you can use. But the enforcement is real. We have seen it here at PrimePay from current clients that are getting audited. There's definitely an increase today than there ever has been. So COBRA notices, ensuring that they're complying under COBRA is very, very important, right? The standards are these, and this is quite simple. It's something that we've known about for years, and it's the general rights notice, right? So as an employee comes on board, they need to understand that you as an employer would be required to fulfill federal COBRA laws and requirements, and that if that employee has a specific life event, then, they need to know, hey, you have rights, as a terminated employee, whether voluntary or involuntary, that you will be able to, capture since you're an employee here of this company. So it's kind of that initial notice describing the right to an extension of group health coverage benefits, and that's going to go to all covered employees and covered spouses. And these are generally mailed, right? Needs to be mailed, generally speaking. That way you have proof of mail so that it goes to not only the covered employee, but it goes to that spouse dependents. When automatically, pretty much within days, automatically when the group health plan coverage commences is when those notices need to be provided. Then, qualifying events, the next main notice is going to occur when a particular employee has that qualifying event. And so this is the notice basically stating their right to elect coverage due to that specific event. And this would go to all qualified employees or all qualified beneficiaries, which would include covered employees, spouses, and dependents. Now, I put two different whens here. When is this supposed to be delivered? If the employer is doing the administration of their COBRA, then generally it is within 14 days after being notified of the qualifying event. So they got 2 weeks in essence. If they are outsourcing the administration of COBRA to a plan administrator, so an outside source, like a PrimePay or other vendor, then generally they're given actually a greater extension, so no later than 44 days after notification of the event. Okay, so these two, the opportunity for an employee now or former employee to go on healthcare.gov, that's alive and well, right? But it has not removed the specific requirement that you need to notify that qualified beneficiary of their right to elect that employer's coverage. So very important there. Also, there's a possibility that an individual, based on the situation at hand, there needs to be additional general information regarding a status change. And this is called the notice of unavailability. So there is no longer the availability of COBRA coverage. Could be an acquisition of that company or something that might have made there's no longer a group health plan in order to provide that COBRA coverage. But it also could be or include underpayment of the premiums or early termination notices, okay, that would go out. So, this would go out to qualified beneficiaries generally who would be affected by that specific notice. And the Department of Labor, what they state is it should come out as soon as practical, but generally within 14 days after being notified, of that event. So that was pretty quick, right? COBRA, there's not too many, but there's still a lot, and that requirement is real. So the best practice for employers that we would state here is that you mail the notices, absolutely mail the notices. One of the best ways through any of the court cases, make sure that you've got proof of mail, okay, that it is sent, that you as an employer, you have done your due diligence. The second thing here is I listed, the first thing is you go on the IRS website and you look at their audit techniques, which they're going to state clearly. One of the things that they will look for is a COBRA procedural manual from that employer. So they will ask for a manual about all of their COBRA procedures. Now at PrimePay we provide that, but if an employer is doing their own administration of COBRA, did they really create a manual for that? Maybe, but I doubt it. So very good question to ask, certainly to current clients or in your prospecting efforts. HIPAA notices. Next item here in our checklist. Clearly HIPAA has been a huge focus, point of conversation discussion for years, right? There is a greater focus here now, created by ACA. HIPAA ties in so much with a lot of the ACA language, and you have seen probably tons of cartoons as it relates to HIPAA, but I kind of saw this one and thought it was very good. But, clearly the lady behind the desk there probably should not have stated that in front of a completely filled patient waiting room, right? So, yeah, probably not following the HIPAA compliance procedures there and the requirements. But by no means, HIPAA, kind of funny there, but it is still very, very important in regard to the notices and disclosures that are needed for employers. So, as I looked at COBRA, COBRA kind of stands alone, meaning these notices are specific notices generated, created through the COBRA rules and regulations. Then there are other pieces and parts like HIPAA that actually touches a lot of the other, it can touch a lot of other notices and disclosures. And I'll mention, HIPAA a lot is covered in the summary plan description for ERISA. So, some of these can be taken care of simply by having the SPD for ERISA. So the first one that I'm showing, pretty basic. A lot of carriers certainly might provide this information. An SPD will clearly state it as well. But this is an initial notice summarizing the exclusion of pre-existing conditions. This would go to all covered employees and covered spouses, and automatically. When group health plan coverage commences is when that needs to be delivered. Now, this is pretty standard, I would say, and I would say if I had to pick a notice, as it relates generally to the group health plans, these are ones that are probably taken care of pretty easily and pretty regularly, by employers and certainly by you, as you're working with your employers. The second type here is the notice of special enrollment rights. This is the notice that is describing special enrollment rights for certain life qualifying events, marriage, birth of a child. This is, there's been some language changes here and due partly to ACA. And this is something that you do want to make sure that as an employer you're providing up-to-date language in relation to special enrollment rights. This would be given to all employees eligible to enroll in a group health plan, and it would be given to them at or before the time an employee is initially offered the opportunity to enroll. So these are generally, this notice would generally be given at the start of the open enrollment period, so if you think about that, that's when that would need to be delivered, okay, prior to that enrollment. Wellness program. For many of you, you probably have seen a lot of information even over the last couple months in regard to wellness. There's still a lot of, I'll say, still some public open forum comments and discussion that is needed in order to define this even more. I think you have several of the departments from Department of Labor and HHS, CMS, that have all kind of have been weighing in and to some degree saying some things differently as it relates to wellness. But a wellness program disclosure would be made in the event that an employer offers a health contingent wellness program in order to obtain a reward, all right? And it would be given to participants and beneficiaries who's going to, participate in the program. And then and when do you do it? It's when with all plan materials, it's automatically added and then maintained based on that specific wellness program that is offered. The next type is the HIPAA Notice of Privacy, Practices, or Breach. I won't name the name here today, but there was another pretty large breach from a large carrier here today, kind of here on the East Coast. It's going to affect, I think they affect over 1 million individuals, and so that is considered a HIPAA Notice of Privacy, Practice, or Breach. And so this carrier is going to need to provide this notice now, which is now following the discovery of that said breach. So this will affect all individuals. We've seen certainly a lot of breaches here just of information, over the past certainly several months. And certainly the last couple years. We will probably continue to see some of these for all intents and purposes, but notifications must be given with no reasonable delay. So as soon as that carrier, as soon as that administrator, as soon as that plan sponsor, reasonably determines the discovery of that breach, they really have no later than 60 days to get this notice out to each of those affected individuals. The last item here is the type of notice is the creditable and non-creditable coverage notice. And I'm just going to ask you all to go to that last part where it says when. It says they're no longer required. So just get over it. Don't distribute this anymore. So an easy one. Just remove it. So the creditable and non-creditable coverage notices are actually no longer required after 12/31/2014. So best practice for employers. The one thing, if I could point out something, at least one thing that I thought that stood out to me was just confirming up-to-date special enrollment rights language is being used. There has been several changes, not only to Section 125 plans, but it has affected it from a HIPAA notice requirement as well. And you just want to make sure that you've got the most up-to-date language that is listed. All right, so everyone get to their computers here again. We are going to go to our third item for your participation, and let me launch that here. I think I'm going to get 100% correct on this one, I believe. The IRS has been granted the ability to enforce COBRA requirements. True or false? So go ahead and make your selection. A little easier. Again, you don't have to get it right. Just participate for the CE. Guys are doing great. Just give here another 15 seconds or so. True or false? Good work. Okay, 5 seconds here. I'm going to close the poll. Let me close that. Let me share it. So the results of this poll, 71% of you are correct. Absolutely true. The IRS, just to put another bit of flavor on this, the IRS can specifically connect with an employer based on COBRA alone. So they can engage an audit on COBRA alone. Now, guess what? When the IRS gets in there on COBRA, well, guess what? They're going to look at everything, just like the Department of Labor does. They might get an inquiry about one specific item, and guess what? They're going to open up the books on a lot of things and just see what else, might be missing. So very interesting. I'm glad, great participation there, but it's absolutely true. The IRS has been granted that ability to make that enforcement. All right, let me hide that. All right, so the next item here is special health care notices. And you know, there are a lot of things I think that get overlooked, and actually I think you know, sometimes these items can kind of create some additional stress. They actually can create additional stress, and as you see from the cartoon, you know, I'm sorry, but stress caused by trying to figure out your health insurance is not covered by it. So, you know, we want to reduce this stress, and I think these are some items here that I think you can help your employer clients not overlook any of these here. So let's kind of look at these here a little bit. And some of these, again, think about where this is coming from. Okay, many times the carrier will be able to provide information in regard to the Women's Health and Cancer Rights Act notice, which is WICRA. They kind of go by WICRA, the WICRA notice. And but this can also be found in an ERISA SPD. It could be a standalone notice, but it does describe the required benefits for mastectomy-related, reconstructive surgery, prosthesis, and additional treatment. Okay, and it would go to all participants given upon enrollment, and it's done annually. And I just capitalized that. This does need to be provided on an annual basis, this specific notice. So there's no specific requirement that, hey, after however many years, you know, you can send it out again. The next item is the Mental Health Parity and Addiction Equity Act notice, and this is going to be specific with the criteria for medically necessary determinations for mental health substance use disorder benefits. This would go to any current or potential participant, beneficiary, or contracting provider. You know, as it says here, you know, any current participant or potential. So this is going to be looking at all eligible participants. And this one here, which is kind of interesting, I think, but it is needed to be provided upon request. And I think to some degree carriers would provide this information, but it's also, though, just to point out, can be something that's also included as part of the ERISA SPD as well. The next item here is the employer HIPAA notice. You know, an employer, not the plan, but the employer must inform employees of possible premium assistance in the state that they reside, right? So every state is a little different here in regard to this specific notice, but this goes to all employees regardless of enrollment or eligibility status. So now you're talking more about W-2s. You're talking about just W-2'd employees, and this notice must be furnished on an annual basis. And so each year, this notice would be given out, okay, under the HIPAA notice. The next item is next type here is the Michelle's Law enrollment notice. So you must include, the employer must include a description of the Michelle's Law for continued coverage during medically necessary leaves of absence. So this is really, you know, this is done annually to all participants and beneficiaries. I believe as well you get some coordination here from a carrier perspective, but you also can receive some coordination here in regard to the SPD. But keep in mind, this is when I'm saying this is done annually, you may not distribute the SPD for ERISA on an annual basis, right? You know, so based on changes, right, or that I had mentioned. So you might have given it to them, and you might give it to them based upon a request that they have made, but you're not necessarily giving it annually. So you want to think of some of these annual notices. These are literally going to be separate notices that will be given to the participants, you know, all W-2 employees and so forth on an annual basis. The next item here is the Newborns and Mothers Act notice. It's going to describe any requirements that relate to hospital length in childbirth would be given to the participants, and generally, again, just what that's meaning is the enrolled, you know, participants, enrolled employees, individuals. This notice, as it's stated, and it is stated within the ERISA SPD, must be included in the SPD. So this is not an annual notice per se, but the actual disclosure of the information needed would be put into would be included in the SPD. medical and national medical child support order notices. This, you'll see here as well that this notice must be furnished annually. I do show both. A lot of times you get the, you just see the medical child support order notices, but I did put both. So the plan administrator directs the plan to provide health coverage to participants' non-custodial children, okay, so that there's some availability of that health coverage to that. There's also a state agency responsibility as well, where that applies and what their specific requirements might entail. And so it says to whom, under the medical child support order notice, that goes to any participants and any child named in that support order, and then the state agency would also provide it to employers, participants, custodial parents, children, and representatives. So best practices, we look at some of these special health care notices. What I do want to reference is, though, that even although the ERISA WRAP CDs will carry many of these disclosures, and it does, the ERISA SPD will carry many of these specific language in the documents, which is a good thing. Better to have it there than not. But many of these require the annual notice, okay? And so these will be separate notices that will need to be given. So a lot of times this will be outside even the ERISA SPD, but you do have a lot of coverage with that SPD. And I just put this question in there, best practice. When's the last time you reviewed these, either as an employer or you as a benefits broker? When have you kind of sat down and just ensured that, hey, as an employer, are you giving this? I mean, your carrier might be providing this to the employer, but as an employer, are you distributing these correctly, or correctly, really, to your participants, to your employees? So the last item here that we have here today is kind of covering some of the key healthcare reform notices, and some of these are going to be very obvious, but I still, I got my picture there of some PrimePay guy here hitting his head. Oh, am I doing these things? Am I doing them right? My question is this: do employers provide them all? Okay, because again, they might be receiving information from the carriers, but are they actually distributing them appropriately and timely to their employees? So let's look at a few of these reform notices, healthcare reform notices. So the first one is very obvious, right? Summary of benefit coverage notice, a key requirement even under ERISA, but under ACA. And as most of you know, there's a template, and this is meant to be a summary of the benefits and coverage under the plan. And there's specific requirements as to font size and the number of pages. It includes a uniform glossary, right? So most of you have seen that by now. And that needs to be given to participants and beneficiaries, generally speaking, by the carrier, plan sponsor, and TPA. Who is that distributed to? Is it truly distributed directly from the carrier to the participants? I mean, maybe, but many times that information is being passed on directly to the employers, and so it's the employer's responsibility to distribute that SPD or SBC. So when it needs to be done annually and upon renewal or reissuance of coverage. And I put in uppercase here within 7 days of request. So they even make a more stringent type of requirement here that we get a request, generally a written request, but receive a request, you've got to deliver that SBC to them within 7 days. The notice of modification. So if a material modification of the plan occurs, and I would say this is probably not going to happen as often, let's say during the plan year, but certainly based on the number of plans that an employer may have, based on a specific carrier and situation involved with the carrier and plans. I mean, it's possible, I suppose, that a material modification can occur, and so the plan must provide notice of that change, and it would be given to the participants and beneficiaries. And it says here, and this is just something really key, so no later than 60 days prior to the date on which the modification will become effective. So this is something that you need to be very proactive with. If there was a significant material modification of the plan, this information would have to be given. This notice would need to be provided 60 days prior to that effective date of that change. The last item, and it's probably, again, it's getting reduced more and more based on the number of these plans outstanding, but grandfather plan disclosures and notices. So just quickly, you do need to disclose that the plan is grandfathered and include all the the information needed based on that specific plan. And this information would absolutely need to be included in any plan materials that discuss the benefits or health coverage. The last just couple items that we have for you here on the healthcare reform notices is the notice of patient protection. I would say that this is a pretty standard notice that's utilized today, a disclosure that's often listed and provided within the ERISA SPD document. It would be given to all participants, but basically it's a simple notice disclosure providing rights regarding choosing their primary care provider, pediatrician, obstetrician, right? So pretty standard stuff here, and if the employer has that SPD, again, you'll notice there's some tie-ins here, so having that SPD kind of carries a lot of that compliance that's needed. The employer exchange notice, as I talked to on maybe a couple webinars before and maybe to several of you in other instances, there is no specific enforcement right now or penalty that would be assessed to an employer for not providing the employer exchange notice. So I don't know, maybe you as a benefits broker look at this a little differently and say, who cares? So I'm not gonna talk about it. I mean, why name one more thing that an employer needs to do, but they're not enforced, and there's no penalty to do it. But I would highly recommend that each of your employers, that you make it a requirement that employers get in the habit of sending out the employer exchange notice, because it provides some very good information to each individual, whether you have coverage as an employer or you're not offering coverage, and so that when that individual needs to go on healthcare.gov or file their taxes, they have the information needed in order to file their taxes appropriately. I mean, it just makes it a little easier, gets them a little more information to understand where they sit. So the technical rule of thumb here, the requirement, is that it's given to all employees. This is all W-2'd employees, not just enrolled or eligible, all W-2'd, and within 14 days of hire. Again, it's not being enforced, so if you have employers who have not been doing it, hey, just let's get them in the habit of doing it here now. It's a good habit to get in, because who knows when that enforcement will begin with that particular notice. The last item here is the internal and external claims and review notices. Now many carriers are going to provide some detail in regard to claims and review, appeals and review. The ERISA SPD covers a lot of this information, so that would be, I think, a huge help in regard to the SPD, having this information. But plans must provide notice of adverse benefit determination, and you've got internal, say, with the plan itself, but you've got external review, which would be outside agencies, in essence, that are going through that review process. So, this particular notice would be given or provided to claimants. And then the external reviews would also go to the claimants, but also to the plan, okay? And so, as to when this notice would be provided for internal claims, it does vary based on the carrier, and the claim. So difficult for me to say exactly based on that particular item. And then external, that's going to vary wildly as well based on the claim and whether state, federal processes applies to that particular notice. So what's the best practice as you look at many of these notices? What is the best practice here? An updated SPD will capture all of the specific new language, special rights, enrollment types of language that's needed, but having an administrator or someone that's really looking over that with your help, you'll really be able to engage your employers to make sure that they have the most up-to-date notices there, at their disposal and at their ready. So again, kind of also look at what do your employers provide. I would put the onus on them a little bit. Showing this list is really key, but kind of go back on them to say, what are exactly you're doing here? You're getting these notices from the carrier, which is great, helps them a lot, but are they actually distributing it to them as needed and as required? So how do you help your clients comply as we begin to conclude? And we've got one more participation item here, so just hang on here to get through the fourth participation requirement for the CE. But helping your clients comply, now what? I mean, you sit in a wonderful opportunity in this discussion, right? Strategies to be able to help maybe your clients kind of dig themselves or get them out of the hole, right? So that they're not feeling that they have, it's only them trying to figure it out, right? Because even from a state of the carrier providing information, gosh, I mean, is the employer really looking at all that information and understanding what they need to do once they receive that information from the carrier? So how can these requirements create maybe some greater stickiness with your employers and your prospects, right? Because this is about not only emboldening, strengthening, building upon the relationships with your current clients, right? Because retention is critical. But it also, there's some opportunities here with this checklist, with this opportunities, just in regard to new clients for you and attracting new clients. So what I first want to recommend is, as you look at these 30-plus notices and disclosures, begin to kind of create, your checklist. I mean, I can't sit here and say that based on your business, the type of agency that you run, I don't know exactly what you sell, do, offer, right, support. So a complete list may not be the list that you need, maybe per se, but create a checklist of these 30-plus notices and disclosures. Have them at the ready. Why? Because you're going to want to verify and confirm specific actions and the delivery methods of each of your employers or prospects, your clients and prospects. I listed a few things there where I said, these things need to be mailed or should be mailed. When can you use electronic delivery? When can I just hand it to them? Should I be doing it every 12 months? Should I be doing it every 30 days? When am I supposed to deliver these? So you have a great opportunity to kind of verify and confirm those actions and when they need to be distributed. You also will want to work with your clients and prospects and just confirming with vendors, right? They work with several different vendors and will need to determine, what are you going to provide ultimately, to the clients, to employers, so that you as a benefits broker can better help say, okay, well, your carrier is going to give this, your benefits attorney will provide this, I could provide this, employer, ooh, we still are missing these 5 things. Where are we going to get this from? So confirm with vendors as to what they ultimately will provide. As I was trying to make an attempt, as well as understand that an ERISA document, plan document, the summary plan description does capture many of the requirements of the annual notices and disclosures. And although you might need to separate some of those notices annually, a lot of the language is listed within that specific plan doc or summary plan description. So something first. Remember, I said it's a foundation for compliance. It is. It's a great way to get started with that. Another great opportunity for you then as well is, and what I would recommend is establish an annual compliance update. You can create more stickiness and opportunities with your employers by not including this on your regular renewal discussion. Separate this out. Talk about this on the side because decisions and information here that is garnered might make decisions change, alter as you get into the renewal process and with your plan design. So establish an annual compliance update specific to compliance, which is, again, one of the top 3 business issues for an employer today, just dealing with the compliance requirements. And then my last question here for you is if you do these things with your clients, could you convert this compliance discussion into revenue for your business? Now, I know the answer, but it's you. You have to look. Each of you are different, operate in a different maybe industry niche. Who knows, right? So it's just looking at these specific compliance requirements, and can you turn these into additional opportunities to sell more solutions, services, support, can you convert this kind of mammoth compliance discussion into additional revenue for your business? I think you can, but that's up to you. So the last action item here for today, and our last question, I know all of you are going, oh, please, the notices. Come on, get to it. All right. So the last question here for today, and again, we need 100% participation. You can select one item there, and the question is this: who is the #1 contact for an employer to ensure compliance with these notice requirements? So is it the carrier? Is it you, the benefits broker? Is it maybe a third-party administrator? Is it just strictly, look, nobody can do this. It's a benefits attorney. I mean, they're the only ones that can actually manage all and fulfill the needs for our clients. Or is it just none of the above? They're on their own. You as a benefits broker say, forget it. Are you kidding? Do I even want to touch this? So go ahead and pick. I'll give you here a few more seconds to make your selection. I see some of you are liking that last selection there. All right, just give you 10 more seconds here. Good work. You guys are doing great with these polls here today. So I'm going to close the poll and just share with you what everybody has selected. So 21% of you had said they're on their own. So might have been a little facetious, or some of you could be actually very serious about that, and justifiably so. You need to understand as an agency where you sit, what are the compliance efforts that you truly can make and impact your clients? Can you do it internally, or can you outsource? Can you provide additional information by partnering, with other strategic partners? Many of you had selected 55% of you benefits broker. To be honest, as I did that question, it was a little, I only let you allow to select one answer out of that. I think many of you might have said A through D, right? Maybe A through E, if you were able to select everything. But I really wanted to put an emphasis here as you, the benefit broker. I think I truly believe that you sit in an awesome situation to have an open and honest conversation with your employers to reduce the risk that they have here with compliance. It's not your risk. It is truly their risk. And you're sitting in that driver's seat to help them all along the way. And so I hope you'll see that as I kind of laid these out today, there's a lot of them, right? 30 plus, okay, as I had listed. But I've given a lot of good content as to, whether they're annual, to whom they should be given. And I hope that as you get this slide deck, you'll be able to review it with a little more fervor and at your own time, and really determine how you and your agency are able to actually impact your clients. So to receive credit, for those of you today that are receiving continuing education credit, if you did not get your attendance sheet, please, no worries. We will get that to you, or you can email concierge@primepay.com. Here, do it right now here after the webinar, and we will get that attendance sheet here to you right away. For those of you who did receive it earlier based on your registration, please complete that. Go ahead and scan it, email it back to concierge@primepay.com, and you'll see there that I actually put the right date, Friday the 22nd. So I know that's quick turnaround, but what we want you to do is just get it to us. After the webinar here today, just get that back to us, sign it, fill it out so that we can get you your credit, and we will make sure that all credits will be applied here easily within 2 weeks here from today. So also for everybody who attended, we will get you a slide deck of the presentation, and we have been recording this, so we will provide that link as well. There have been some good questions, so I will look at that to see if there's additional information that we could provide that would be helpful to you in the follow-up to this email. Broker Concierge Partners, I can't thank you enough for your business, the confidence that you have given. Thank you for working with PrimePay, and we look forward to continuing our relationship and strengthening that relationship. As you think about partnering with PrimePay, we hope that you see that we can help in regard to many of these compliance strategies and assist you as you're talking with your clients about the implementation and distribution of these various requirements. So with that, again, thank you for your attendance. this will conclude our webinar today. Look for more information in the future about future BC Broker Concierge exclusive CE webinars. Have a great day.